Hey everyone, we're back. I am PA Clarke, and we just had a beautiful treatment with this sport on the forehead, glabella, crow's feet. Now we're diving into the cheeks to enhance and elevate the anterior and the lateral cheeks. So Lizzie, any questions about your cheeks? Anything in this region?
Yeah, well, I actually felt that I have lost a lot of fat here, right? And I have to say that I'm super afraid of dealing with my cheeks.
I see.
Because I don't want to look artificial at all.
Perfect.
We've talked before, and you know that I like everything super natural.
Absolutely.
So I wanted to look like healthy, and like I usually say, I don't want to look like I'm 25 when I'm not, but I want to look like a healthy 26.
Okay. I'd get you 28, maybe 29. So the cheeks are very dynamic. We're dealing with fat pads, ligaments, reticular structures, the bony skeleton, and the skin itself. And all of these structures undergo their own separate aging parameters. So let's look at why Lizzie is having some depression and some hollowness within the lateral cheeks and also the medial. So Lizzie, I'm going to draw some of the fat pads on the face so we can see. So let's look at some of the fat pads. We have our superior malar fat pad, which runs along here. Then we have our deep malar fat pad, medial cheek fat pad, that runs very deep. And as that deep malar fat pad gets hollow, you get indentation or contouring. Then we have our temporal or fat pad that runs along the side of the face and kind of runs slightly horizontal to the jawline and underneath. And that fat pad comes all the way around here. And as this fat pad hollows, then you get the hollowing within the lateral side. So Lizzie doesn't have that. But we have the medial and anterior fat pads. We also have our nasolabial fat pads that runs in this direction as well. And we have our superior and inferior jowl fat pads as well. So today we're not going into the lower face, but we'll stick to the upper face, and these are the fat pads we're going to enhance to really get Lizzie back to where she was not too long ago. So let's dive into the fat pads and we're going to enhance. There are two products I use for the medial and the lateral cheeks. Medial cheeks are typically going to be the regular Restylane, and the lateral cheeks are going to be the Restylane Lift. Now, why am I choosing these products? These are Nasha products. These are sculpting products. It's very important to note that we are going away from making the face into pillow structures. We don't want fat cheeks. Lizzie, you don't want fat cheeks. You don't want wide cheeks. You want your cheeks just slightly better or more youthful, more healthy looking. In order to do that, I have to sculpt Lizzie's cheeks. I cannot just fill Lizzie's cheeks, which means that I need a product that has the right characteristics to create the lift and the volume necessary. And you're going to find those in high G prime products like these two products. So lift goes on the outside and regular goes on the inside. There's a third product called Restylane Define, and Restylane Define is going to work in the medial cheek pockets, and that enhancement is going to give a lovely contour and fullness to the upper cheeks, leaving that beautiful contour in the lower cheeks as well. So again, we're not just filling cheeks, but we're recreating what Lizzie had based upon her topography or based upon the structures in her face already. So are you excited?
I am. I'm curious about something.
Sure.
With Botox, I know that even though it shows quick, that I will see the difference like within a few days. With fillers, is it a few days after or it's immediate?
So fillers are immediate.
Oh.
So as I do the treatment, I am seeing exactly in real time what's happening and what will occur. And that's a super point. if I have control over what I'm doing, I cannot use a low G prime in your cheeks. Why? When you go home, most people sleep on the face. So the weight of the head is approximately 12 to 14 pounds. That's a small watermelon. When you sleep on your cheeks, after I've augmented your cheeks, what are you going to do to the product? You're going to crush and flatten the product. Therefore, you're going to spread the filler that I place, making your cheeks much larger than what I want. To combat that issue, what I use is a high G prime product, which is going to stay where I place the product. So if I place my high G prime product here, in 2 weeks, I should see it there. So because I'm using a high G prime, whatever I do on your cheeks is definitely going to be there when I see you in 2 weeks.
But I'm a smart patient, and I
Right.
got myself a neck pillow to sleep on, so I will not touch my face.
Absolutely. Don't sleep on the face. If you sleep on the face, you are creating your own aging. You are expediting your own aging. Aging occurs not only from the sun and the foods we eat, but also from our daily habits. Overwashing the face, not moisturizing the skin, and also sleeping on the face, or diet and smoking. These are all parameters that contributes to our aging. Let's look at the tear trough. The tear trough is an area underneath the eyes that sometimes creates a depression that runs kind of diagonally down and out. And with Lizzie, you can see that it's more prominent on her right side. This is Lizzie's tear trough, but in reality, it's the upper cheek as well. So many times you can augment the upper cheek and also augment the tear trough as well without diving into the tear trough. So there are many different techniques that can be used to augment the tear trough, upper cheek, without actually going into the tear trough. And you will definitely see that today, where I can manipulate my product, especially if it's a relatively high G prime product like Restylane Regular, Restylane Classic, to get that filler where I want it to go without going into a high vascular zone like the tear trough. So if you've ever had any bruising and swelling and kind of weird puffiness under the eyes, it's because the approach to that area wasn't necessarily the best approach for your eyes. And this is the tear trough region. And this is bordered by the tear trough ligament that runs just kind of horizontal and from the corner of the eye out into the cheeks. And this is what we will work on today, which is just above the zygomatic cutaneous ligament. Now, these are all structures in the face. Obviously, you may not understand what these structures are, but in order to be an artist, you have to understand anatomy of the face. You must understand that you're dealing with structures that are slightly different in everyone, but with the understanding that you know where these structures are, how to avoid them, and where to place your product, your filler, either above or below these structures for maximum benefit. All right, so let's jump into the
face. So I have a question here.
Yes.
Something that I have noticed is that this area here looks healthier or more tired, like day to day. Sometimes I look better than other days, right? I'm not sure like if I'm at my best, for as bad as it may look, or at my worst today. But I have noticed that there are days that my eyes is like, they look darker, deeper than other days.
So that I would say relates a lot to whether you're retaining water sometimes. When you are retaining water, we get a little more puffier, especially under the eyes and around that region. The skin is very thin, so everything shows. And with that, the contrast, it can create more shadowing in the tear trough region under the eyes, whereby it will look more hollow or more darker or more depressed, or just not as bright and full as other days may be. That's one thing that I've seen. Heavy drinking at night, which I'm sure you don't do, but also intake of high salt diets. Something like soy sauce, which has a tremendous amount of sodium in it. You can retain water afterwards and be very bloated in the face, which can change the way your eyes and your face looks, especially after filler is done as well. So once filler is done, I tell my patients that for the next week or two, try to stay away from high salty foods or high sodium diet as well. So that's an interesting question, but yes, so fillers work with your body. They're very dynamic.
So there would be like a diet restriction, big kind of, not restriction, but like...
Yes, correct. Absolutely. Remember, what you intake shows up on the outside many times over. And
That's
this
sodium.
absolutely, absolutely. Okay. Tiny little mosquito bites. Very nice. So I'm just shaping the filler. Lovely, look at that. Nice and smooth, right? It's really nice. Really picks up that side nicely. Now I'll use the other product, which is the lift. 1, 2, 3, tiny little stick. There you go. Good. This takes away some of the hollowness that happened right in here. One, two, three. So you can really appreciate how much more hollowing you have. 1, 2, and then this in here. Awesome. You're doing great. Okay. Nice. Very good. I'm just going to come up slowly. 1, 2, 3. And here we're just going to roll this up for you. No, there should be zero discomfort or pain except for my fingers squeezing. there. Hmm?
Are you doing one full syringe?
This side is getting 3/4 of a syringe. The other side got 1/4.
Oh, really?
Yeah, this side was so hollow.
Wow.
So now I'm shaping, and this is the G prime I'm talking about, the tightness of the product that allows me to shape it once I inject. You see how I push some? Did you see some of the product go up there, right? So this is what I mean by using that product. You can actually put it where you want to put it, and this is why sleeping on the face is not a good thing at all. So little by little, I'm working my way with the different products to lift and enhance. It's a really slow process in getting the product where I want it to go. And this area always likes to bleed, so I have to be really careful how much I go right here. Very gentle. I'm just changing needle, and then we're gonna bring this side. Hey all, so great, we're back after our full treatment of toxin and fillers to the upper face, which is the upper cheeks, and that includes the under eye, middle cheeks and lateral cheeks. And we have Lizzie, who was such a brave soul and has such a great experience and great injecting, and we really kind of introduced more harmony into the upper face. So let's take a look at some of the things that we did just before we grabbed that mirror. So first of all, it was the toxin, the Dysport, full 3 areas, and then we work to have the harmony between the right side and the left side. Now again, I am not stressing symmetry, I'm stressing harmony of the face, so harmonizing the cheeks. And so we have on this side, we don't have that hollowness under the eyes anymore, we don't have the hollowness in the medial cheek or the middle cheek region. And these were 3 separate products that were used to enhance each of these areas. So Lizzie got about 75% of the product on this side and about 25% of the product on this side, but you can clearly see the harmony that's here, and this is without makeup. So Lizzie, so let's grab the mirror and let's see where we are.
Oh wow, I got cheeks.
Yeah. And take a look at the height between both sides again that we discussed, right? And you'll find that the shadowing that you had also isn't there. So when you're applying your makeup and you apply evenly between the left and the right, you're not going to have to put more on one side or try to hide shadows on one side more than the other, because your cheeks are lifted. Now we use 3 separate products. And those 3 separate products, you know, you really need quite a bit of products to really enhance, but these 3 separate products did 3 specific individual things. One was a higher G prime to hold and lift the musculature and the fat pad on the lateral cheeks, yes. And then there's a lower G prime, which is slightly lower but a smaller particle size, to work on the under eye to kind of lift this hollow region called the tear trough region, which is the upper cheek as well. And then the last was the define, which is the Restylane define, to open up the hollowing of the lower cheek. So 3 separate products, and sometimes it requires multiple different products. So you should never have one product fits all. You know, time and time again, I see patients come to me and they have the same product in the cheeks, in the temples, in the lips, in the jawline, in the chin, and it just doesn't look right because one product cannot work everywhere. So Lizzie, I really love this result. I think it was absolutely wonderful. In 2 weeks, we're going to take a look at the after results, and we're looking for the smoothness, the closing of some of the pores on the forehead, the softening of the frowning between the eyebrows, the height of the eyebrows that are going to elevate, the symmetry of the eyebrows that we worked on as well, but also we're looking at the under eyes to see the harmony between the under eyes and the cheeks. Now sometimes patients may need a tiny touch-up, so if that's necessary, I will show you how I do my touch-ups on patients, which are typically without charge. So definitely I love this result, and I would definitely see you in 2 weeks. Do not sleep on the face. Do not sleep on the face. If you sleep on the face, you can change some of the results, but you can also enhance some of the creases and the lines in the face. Do not sleep on the face. Bye bye.